So I just made it back to the office after my procedure today. I did a deep plane facelift, brow lift, lip lift, and fat injection. And she looks amazing. I'm super excited for her. One thing that I thought about today that I wanted to touch on though is I had her do Morpheus before surgery because her skin was so thin. And it's one thing that some online are actually demonizing a little bit, both Morpheus as well as biostimulatory fillers like Sculptra and Radiesse. They're saying that it can create scar tissue and basically adhere the tissue planes together. And that could be the case if done by someone who wasn't very experienced or maybe injected in the wrong tissue plane. But one thing that I've seen is I have not had that experience. And because most of my patients are getting non-invasive treatments either personally by me or my esthetician or nurse, and I control those settings and depths, and I can basically prevent a lot of those things from happening. So a lot of the scare tactics out there with certain injectables, certain skin treatments, I think are unfounded because it very much depends on the person doing the treatment. So the patient I had today did Morpheus, and I did a deep plane facelift, and I did not see any of the scar tissue or anything like that from her treatment. And because of the reason why that is we stay very superficial when we're treating someone, especially with really thin skin and not a lot of fat underneath the skin. And so it actually thickens the dermis, and I can reposition the tissue planes a lot more effectively. I also find that they have a lot more longevity to their facelift results if they treat the skin with Morpheus, sometimes adding in lasers as well. I wouldn't be afraid of Sculptra or Radiesse or Morpheus, but be sure you do your homework and go to an experienced person doing the treatment. I hope that helps. If you have any questions, leave a comment below.